It's being referred to as the holy grail of cancer detection. It's a simple blood test. It's now available in India. A test that's been designed by India's Epigeneres Biotech along with Singapore's Tzar lab. The chairperson of Epigeneres is Ashish Tripathi, who comes from a singularly accomplished family. He has worked with his brother Anish on this technology, and his brother is the well-known author Amish. But what we're talking about here, in simple terms, has been described as the biggest breakthrough in molecular diagnostics to detect early-stage cancer. And the test, which is, as I mentioned, a simple blood test, is now available in India. Ashish Tripathi joins us. Thanks, Ashish, very much for being with us. You know, we discussed this several months back, and there was a lot of optimism, there was a lot of hope in the technology itself. It's now available in India. In simple terms, is this technology that can potentially save countless lives?
Vishnu, it is, because firstly, you were one of the first journalists that covered our story when we had completed our 1,000-patient study. But what we had told you at that stage was that this was the first pan-cancer blood test, and two, it was the first prognostic test for cancer. So not only can we tell you that you do not have cancer, but more interestingly, we can tell you that you will not get cancer for the next 1 year. What I had promised you on your show was that that we would be launching this product in India first, because this is where the breakthrough was made, and this is where we conducted the first clinical studies. Right now, we already have our NHS trials started, and for that matter, we are actually also getting into US trials. But that said, I'm very proud to have actually, for our lab to have actually come up in India. You had also interviewed my elder brother Anish with me, and he's the person who actually heads Epigeneres, and he's been instrumental in making some very key breakthroughs to be able to standardize the process in India. And this is going to be a massive breakthrough, because if you can detect all cancers from a simple blood test, the vision that we have is all of us need to do this test once a year, and we will always catch cancer at stage 1 or before, when it is infinitely more curable.
Ashish, how much does the test cost?
It is going to be priced at 14,000 in India, just so that you know that this test is going to be priced at about £400 in the UK and about $500 in the US. But once again, our intent was to keep the pricing as low as we possibly could in our home market, and our promise also is that we will keep driving that price down as we increase the capacity and we get the economies of scale. We want all of us, all 8 billion of us, doing this test once a year. So we will keep driving this price down so that it's most affordable to, and everyone does this test.
What about peer reviews? Where do you stand with that?
So, Vishnu, actually, the last 3 weeks have been surreal, because we got published in Stem Cell Journal. That's Oxford Academia's Stem Cell Journal. And, for a scientific company, it's always satisfying to be published in a high impact factor journal. And our article, for the scientists among you that are watching your show, has become one of the most well-read papers in the last 3 weeks. In fact, I would encourage you to take a look at the altmetric score. And it's literally been retweeted by Harvard professors, NHS scientists, and University of Paris scientists. We've also been published in New York Post, Daily Express in the UK, Marie Claire in France, and so on and so forth. But what is, of course, very satisfying is when you get published in a high impact factor journal. And the reason this article was important was because we have disclosed the science of how this particular technology works. And that was a very critical piece that we had promised we would do when we were launching our service, and we have put our science out there, which is one of the reasons why we intend to do, we're getting so much attention from even US labs to conduct follow-on trials.
And so the initial trials were what, 1,000 individuals who were tested?
Yeah. So the Indian study was a 1,000-patient study, 500 cancer, 500 non-cancer. And if you remember, we had got a very, very high sensitivity and specificity result, because actually we detected each and every non-cancer patient, and we detected each and every cancer patient. In fact, most of the scientists struggle to find out how can you get this high level of sensitivity. There's no magic. I mean, now that the science is out, we can actually explain to you. The breakthrough was that we realized that there were certain stem cells that were getting epigenetic changes and becoming cancer stem cells. The cancer stem cells grow into cancer cells. 1 billion cancer cells come together to form a tumor. Once the tumor forms, it sheds its outer layers, which are CTCs, and when they break down, they release their contents, which is ctDNA and cell-free RNA. All the liquid biopsy companies in the West were busy looking at these resultant markers, tumor pieces and the tumor fragments. What we had stumbled on was a causative marker, which actually shows up in the blood 18 months before the tumor even forms. So by the time the tumor forms, you're getting very, very loud signals, as opposed to CTCs and ctDNA, which are only starting to form, right, once the tumor has formed. And effectively, to see them at an early stage in the blood is very, very difficult. And that was the reason why we made this breakthrough.
And in terms of regulation in India, because before you are allowed to market this, obviously, and sometimes our processes are tougher than anywhere else in the world. Where do you stand? I mean, you've obviously gone through that process. The reason I'm asking you all of this is because, it is very much the holy grail. And I think it's important for our viewers to understand that A, it's been peer reviewed, it's been published, and it's gone through a regulatory framework. And therefore, my question is, again, in India, where were you or where are you in that regulatory framework?
Vishnu, we have actually got the permissions to be able to launch this as a private service in India already, for the simple reason that we have actually already completed a 1,000-patient study. But we are in more advanced discussions even with ICMR to do larger studies in India. What is particularly satisfying for us, though, is that the imperial study, and not to belate the point, but the reality is that even for Indian doctors and scientists, it is important once you have actually got results in a Western study. Right. And the interesting thing from our perspective is that, look, our imperial study has started. But what is gratifying is just this week, NIHR, which is the main funding body of NHS,
yes,
has actually just given us a grant to do a larger study for lung cancer as well, with a very respected university. And not just that, the ex-president of the cancer moonshot, President Biden's and President Obama's moonshot, has just joined our medical advisory board. And he has made some very critical, introductions for us, even in the US. And we are in fact in talks with Mount Sinai and NYU to do follow-on studies there as well. So it's a big year for us. I mean, we are going to be doing Western trials. We have launched in India, and the other major breakthrough that we've made is we've just partnered with a US company to automate certain critical parts so that we can significantly increase the capacity of blood samples that we can process. And that, again, actually will help us drive down the price and actually do many more samples than what we currently can.
And would you be looking, for example, at a publication in, let's say, Lancet in the future, just in terms of the technology, the acceptability, the peer reviews, that sort of thing, the process? Again, it is so important because it's almost a miracle what you've come out with over here, and there'd be people watching this and saying, "Oh, how do we know it actually works? What do others have to say?" And hence, I asked that question.
Vishnu, Oxford Academia Stem Cell Journal is a very, very respected journal, and we are speaking to other journals as well. As you know, that you have to go, you can't publish the same breakthrough in multiple journals, right? But the reality is that there are other papers that we are actually speaking to other respected journals about. We are also, we are reaching out to Lancet and New England and other journals as well. The way we see it is that we know how critical the Western studies are, because once we have completed those studies, right, I think you're going to see a significant amount of interest already. I mean, if you've actually followed the story, it's in social media, this time around,
it's incredible,
actually
and
been
I have
covered.
followed that story. And I think perhaps the most impressive part of that story is your tests for early detection of cancer so far is at 100%. In other words, if the test is done properly, obviously, right, then you will get a result one way or the other. And the result is cancer is absent, it's imminent, or it's present, right?
Vishnu, if I can just actually state one thing, because this is a very critical point that you've raised, and a lot of scientists actually struggle with how do you actually get such high sensitivity and specificity. And if you don't mind, if I can just explain
Go ahead,
it,
please. I'm all ears.
Right? There is something called a Gompertzian model. It was coined by an English scientist called Benjamin Gompertz, where he plotted the number of tumor cells, right, on the y-axis and time on the x-axis, right? And what he said is that cancer goes through three phases: early phase, rapid expansion phase, and the plateau phase, right? And he said the tragedy of cancer today is we only understand the disease in the plateau phase, which is from 1 billion to 1 trillion cells of cancer. Now, what does that mean? 1 billion cells of cancer is a 1 cubic centimeter tumor. It's a small tumor in any cancer. And by the time that you reach 1 trillion cells, you've passed fourth stage and you've got fatality, right? But 1 billion cells don't form in a day, right? The reality is the reason we are an early detection company is because we have figured out how to read the different stages of non-cancer. Remember that all the liquid biopsy companies, they are looking for tumor cells. So the absence of tumor cells indicates non-cancer, right? While we get a physical reading for the stages of non-cancer. Absence of evidence is not the same as evidence of absence, right? The reason we can actually detect this cancer so early is because we detect it at 100 million cells.
Right.
We detect it at 1 million cells. We detect it at 10,000 cells. We detect it at 1 cell. We detect it 6 months before the first cell is born, because we are not interested in the cancer cell, but the causative cell, which is the cancer stem cell. And that is the reason for our high sensitivity and specificity, right?
Yeah.
Now, that said, this is not to say that if you actually do 100,000 studies, we may not get a couple of errors. But
Sure.
the fact of the matter is that if you're trying to actually compare this with a cancer cell approach, right, we have a significant advantage because our cells show up in the blood a
Right.
long time before the tumor cells ever do. And that's the reason for our success.
Now, one of the reasons, all of you went about with this study and got the idea is because the late super cop in Mumbai, Himanshu Roy, tragically was diagnosed with cancer, and then, he passed away. But he's somebody who's influenced your family very closely. I mean, could you tell us about that influence? In fact, the test itself, as I understand it, is called HR with a particular number attached to it, right? So could you tell us, our viewers, about that link?
Vishnu, look, journalists like you have actually spoken to my late brother-in-law,
Yes,
right?
yes.
And in my humble opinion, he was one of the most mesmerizing, one of the biggest intellectuals that, I ever met. Right, a few weeks before he had passed away, right, and he had a curious sense of humor, if you remember, right. But he had actually he was sitting with me, and he had picked up one of his chemo medicines, and he asked me, Ashish, have you seen, I don't know, there was some obscene figure like 8-9 lakhs disappear in a second. And I said, no, I haven't. So he just put the pill in his mouth, drunk it, and he started laughing. And he said, Ashish, we can afford it, but the reality is, what are the poor even supposed to do, right? The cancer has become such an expensive disease, right? That it is. I know of affluent families. My wife is Australian, who have actually put all their wealth to try and save one member of the family. And the tragedy is that after spending all that money, you don't even save that person, and the family has gone bankrupt, right? And the reality is the only real solution with cancer is actually finding it early. And that is what our vision is. We are going to drive down the price of this test because we want everyone doing this test once a year, because we believe that if you do that, we will turn cancer into an early stage disease when it is infinitely more curable. And
so
that
let's
is the
talk brass tacks over here. It's just a simple blood test. And how long before the report comes?
So right now it does take us about a week, right? Like I said, we are automating it, right? And Elon Musk had once said that making a breakthrough in a lab is one thing, right? Making it into a production process is actually complicated, right? And to that extent, I'm kind of lucky. Look, I unfortunately lost my father 1.5 years back, and he was the main driver behind this breakthrough. But I'm so glad that the other gentleman, my brother who you interviewed the last time as well, along with me, he's cut from the same cloth, and he has made such major breakthroughs in the processing of these samples, and we're so glad. Look, we've got some very cutting edge scientists that are doing phenomenal work. This breakthrough has been entirely made in India, and it's something that it just makes me so proud that India obviously has.
So tell us, Ashish, a little bit about that, because that is fascinating. We are, for example, brilliant in India in replicating medicines. We are champions in making vaccines, for example. Very often the vaccines aren't our own design, but now increasingly they are as well. But when you tell me that there were Indian scientists who were actually responsible for developing this test, could you tell us a little bit about the people who actually did it, who actually came up with the formula on the basis of which this is a game changer?
So I'll tell you, look, we've got a strong team of 72 people working in the company right now, right? But there were some 10 to 12 people that were very, very critical. There is, led by my father, of course. But the reality is that we have certain scientists that have, we have a scientist who was a very senior scientist in ICMR. Right, who actually heads our research arm. There are other scientists that are Harvard scientists that have actually been trained in the UK for a long time, and we've got a very, very sharp team. And believe me, we will actually put this out in more detail in due course. But this breakthrough is really thanks to them, because. We will actually put out the entire story, because there are many parts where we had roadblocks, and it was brilliant the way these guys have actually been able to solve it, right? But if I can add another thing, that something that gets forgotten is that these cells per se were not found by us. It was found by an American scientist in an American university. It's just that they had found it in tissues next to the tumor cells. Right? And what they had hypothesized, in fact, they had hypothesized that these cells are growing into the tumor cells, but it had no diagnostic value, because what is the diagnostic value of a small cell sitting next to a tumor telling you there's a tumor close by? Yes. If you can zoom in and see the cell, we'll zoom out and see the tumor. The tumor itself is so small, you're not going to see it, right? The breakthrough that our scientists realized was that we could isolate them in peripheral blood. And then, of course, we realized the diagnostic potential of this. Right, but the point is that it's a leap in. But there was a lot of primary research that had been done by scientists in the U.S., in Europe, in Asia, right? And breakthroughs like this actually are the workings of many great minds, right? But this is not to take away from our own very special scientists.
And Ashish, I'm just trying to understand, what are your next timelines or your goals? I mean, you're now setting up in Bombay. I believe you're going to be in Delhi soon as well. You've got a timeline for more research in the United Kingdom. You're tying up with people in the United States. When will this test be commonly available around the world?
So, you know that Kotak Private Equity and Satya Capital actually invested in us
Yes.
last year, and we do have some marquee scientists. The reality is that what was critical for us was to be able to turn this into a production process, because that's what makes this into a growth engine, right?
Yes.
And we've achieved that in Bombay. What our investors now want is for us to actually open multiple other centers in India, and therefore we will be doing a capital raise in India as well. But what is pretty interesting is that there has been a lot of interest from both strategics and financial investors in the West, because once they get over their incredulity of that this could be real, right, and they've understood the science, right, cancer is a problem that a lot of people have been trying to solve, right, for the last couple of decades. I mean, don't forget that President Nixon had said we'll solve the problem in the decade of the 70s. And of course, we've got President Biden, who's actually working very, very hard to find, and that's what the Cancer Moonshot is doing. So believe me, there are very special minds that are actually trying to solve this problem. And now that we are in touch with them, we will actually, once we've completed the Western trials, this is going to actually find a way into the Western systems very quickly as well. But you have to follow the regulatory paths in the different countries, right? And that's essentially what we're doing.
A final question, this applies to all cancers, right?
By the way, we've written our science of why we believe it works on all cancers, because these stem cells are the culprits for all cancers, right? But remember that what we should claim is the clinical study that we have done. And right now, we have done it on 25 cancers. All the big ones were there: breast, ovarian, lung, leukemia, prostate, pancreatic. The reason the Indian scientists and doctors were so impressed was because it was working on solid cancers, it's working on blood cancers, it's working on soft tissue sarcomas. But cancer is a complex disease. There are 200 different types of cancer, 3,000 subtypes, right? So it will take us a little bit of time to finish all the cancers, right? But yes, our view is that this will work on all cancers.
Look, Ashish, we'll be tracking your story very closely. It's absolutely fascinating science, and it gives hope, I think, to so many around the world, and it will save lives if it's not already starting to do that. And hopefully it will be available at a less expensive price going forward, as it's accepted not just in India, but around the world. Wonderful speaking to you. Thank you very much for being with us.
Thank you. Thank you so much.